Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mushroom poisoning is called as mycetism. Mycetism or mushroom poisoning. In mushroom poisoning, the patient will present with diarrhea, urination, meiosis, bronchospasm, emesis, lacrimation, increased salivation. There can be bradycardia, hypotension, and thus shock. So all these will develop in 60 minutes, 30 to 60 minutes of ingestion of the mushroom. And the treatment of this muscarine or mushroom poisoning is atropine. Atropine is given in the dosage of 1 to 2 milligrams intramuscularly every 20 to 30 minutes.
thank you and thank you for watching.